To NP Certification Academy. Today we're going to be going over the Ciwa calculation. To reach us, nursetonursecoach@gmail.com or info@npcertificationacademy.com. So look, Ciwa definition, what exactly is it? So the Clinical Institute Withdrawal Assessment for alcohol is called Ciwa. Is a tool that is used to assess and monitor the severity of alcohol withdrawal in patients. It includes 10 items, and that is what we must now understand and remember what they really are. And the way to remember the numbers, I'm going to carefully explain to you. Don't forget, there are so many scales out there. This is not the only scale that you need for tests. This is just a sample or one piece of the scale. So what exactly is the importance of Ciwa? To guide us in treatment decisions, for patient safety, for standardized assessment, to monitor patient progress, and to improve outcomes. Those are pretty straightforward, so we don't need to go too deep into that. So what are the 10 items? It is nausea and vomiting, and that is one word. It is tremors, paroxysmal sweat, anxiety, agitation, tactile disturbances, auditory disturbances, visual disturbances, headaches and fullness in the head, orientation and clouding of sensorium. Again, the 10 components of Ciwa are nausea and vomiting, tremors, paroxysmal sweat, anxiety, agitation, tactile disturbances, auditory disturbances, visual disturbances, headache and fullness in the head, orientation and clouding of sensorium. So what exactly is the scoring? Is 0 to 7 for items 1 to 9. So that is so watch that. We have two different numbers, okay? But I just wanted to make that clear. It's not going to be this complicated on the exam, but we still need to be familiar with these numbers. A 0 to 7 for items 1 to 9 means increasing severity. A 0 to 4 for item 10 is equal to, is based on patient's awareness of time, place, and person. So we are excluding this one and we are putting the rest in the same box. Does that make sense? Because orientation and clouding of sensorium will be very variable based on, are they aware of time? Are they aware of place? Do they know who they are? Total score. We have a total score. The max score we can get for Ciwa is 0 to 67. By the time you add up all the items, you can get them that high. But then, how do we interpret the step-by-step numbers that we get? We also have mild, moderate, and severe. Mild, moderate, and severe. So 0 to 9 is mild, 10 to 19 is moderate, 20 or more is severe withdrawal. That is how we interpret the withdrawal scale. Now, so how do we use Ciwa then? Again, first of all, we repeat it every few hours to monitor patient status and adjust treatment. You must know that for what? For tests. You must know that for what? Exam. All right? It is frequently tested on national exams. What is the purpose of Ciwa? We use it to monitor patient status and adjust treatment. You do Ciwa on the unit. You may just not be thinking or connecting with it somehow, but we all do this, okay? If you check in your documentation right now, you will see this Ciwa in there. So nausea and vomiting, tremors, paroxysmal sweat, anxiety, agitation, tactile disturbances, auditory disturbances, agitation, visual disturbances, headache and fullness in the head, orientation and clouding of sensorium. So now, when we talk about paroxysmal sweat, if it is severe, see how they are rating it right here, 5 to 7. But the worst part of the severity is going to be 7. So on the exam, if they tell you that somebody is having paroxysmal sweat and it is severe, you're going to call it what? 7. Okay? You cannot use a range to calculate. Do you understand what I'm saying? You can't. You need just one number to pick to calculate. What about agitation? If it is severe, that one is also from 4 to 7. But of course, we're going to assume 7 is the maximum. So we are assuming it. So 7 is going to be the maximum for severity. So if you get a severity question, you are using that what? Severe number to do what? To calculate. Now, let's now talk about total question. Let's talk about the question. So let's say somebody is having severe paroxysmal sweat, agitation, and they now have visual disturbances. So Let's assume that the severe scale is 7. So calculate. What is your severity scale? So you now have 1, 2, and 3 symptoms. 3 symptoms. You now want to take that and do what? And multiply that by 7, right? To get what? 21. That is it. It is that simple. So you must just pay attention. Is it mild? Is it moderate? Is it severe? What number are they giving to you? What level are they giving to you? Another thing that can lead to confusion is this. You know, this interpretation is not, okay, so now, when you now get this number, okay, when you now get this number 21, you will now see where it falls under here. Where does it fall under? It falls under severe. Does that make sense now? This calculation will help us interpret the scale. Am I making sense? This answer right here will help us interpret the scale. So look, total scores. Paroxysmal sweat is severe. Agitation is severe. Visual disturbance is severe. That is 1, 2, and 3. 7 plus 7, well, it doesn't matter if you do plus, but I just call it a day and multiply. 7 times 3 is equal to 21. Listening to our channel, I really hope this little calculation kind of clears, the question out for you. So Ciwa is one of the many skills that we have right there. We discussed the other skills in class. So you must enroll and become a member to have access to how we teach it and simplify things and take you right close to the exam. Listen, nobody have exam questions out there. Stop looking for questions. Let's study together. Come join a very studious group. You're going to meet other peers that are in the same shoes as you, and then you're going to be able to study, and we're going to pull this through this together. So we are here to support you 24/7. Please, be careful as you sign up and look for reviews, and make sure that you're signing up for a review that really meets your needs. We do support students with heightened anxiety. We support ADHD students, ADD students. We support students with some, learning issues, because we come down to your level, and we also allow you to repeat as many classes as possible. In addition to that, we do not let you go until you achieve your goal. You come into the circle of exam success, you are walking out with your grade. Does it make sense? In addition, after you pass your boards, we also add you to a group. It's called the Experts Group. Listen, the networking out there is not too many. In our group, we also allow you the networking necessary to go to the top of your career. So what does that mean? You're going to network with people that passed their boards already. They own their clinics and very, very successful. In addition to that, there is a lot more opportunities, a lot more knowledge to gain. Every Thursday, we meet to discuss pharmacology, to discuss real cases. Are you struggling with a case on the job? You bring it on. We all meet on Thursdays from 9 p.m., 8 p.m. to 9 p.m. Eastern Time. After you pass your board exam, right? We give you the tips and the tricks on how to survive your very first job, the tip and the tricks on how to survive your interview. And it's a lot more opportunities out there that you can benefit from. So we look forward to having you in the circle of exam success. www.npcertificationacademy.com. And if you pass your boards already, please visit www.confidentprescriber.com. Thank you so much and have a wonderful day. Bye-bye.